Well, we're almost here at 6 Eastern, so I'll just let you kick it off. Welcome back, everyone. This is Mike and Bettina here with Zymogen. We're very excited. We have Dr. John Brimhall and Dr. Cheryl Burdette. And Dr. John wanted to kind of give a little background perspective on an upcoming seminar and then introduce Dr. Burdette. So, Dr. Brimhall, I'll let you go ahead and take it over.
Okay, you hear me all right?
Sound great.
Okay, very good. Well, we certainly appreciate everybody being online. We had an incredible amount of people sign up, and we hope to keep clicking on here. Dr. Burdette probably needs no introduction. I have never thought anybody could talk faster than I do or give you more drinking from a fire hose, but she can do that. We have her on today on my program for a very specific reason. She's going to be a guest speaker at Homecoming, which is January 24th through 26th in Phoenix, Arizona. And we're already talking about that because it is going to be the seminar of all seminars throughout 2014. We always know that there's a great famous saying that in the doctor of the future will be the one that uses no drugs but uses natural things. And that's exactly what we're going to teach you to do in January. Dr. Cheryl will be talking about some of the things we're going over today and a whole lot more heavy duty into methylation and gut and allergies and that type of work. I'm going to be covering acupuncture, nutrition. We're covering bioinject products. We'll be covering cranial work. Dr. Brett will be doing neurology. We have Dr. David Singer, who was one of the premier practice builders of all times. He's actually just, I think, a year younger than I am. He's been around a long time, 41 years, something like that. And he's taken a whole section. We have Dr. Merkel, who it's his science-based nutrition program that we have put together for Zymogen and Biointerject, and he's going to be doing a whole program. Ryan Fraser is going to be on there covering the top 10 products that Zymogen has on board, and I'm going to be talking about the top 10 products that Biointerject has. So you can see it's an incredible crew, and we want you to mark your calendar out right now. I don't want to take much longer than that, other than to say that we're recording this tonight. We've recorded all the webinars we have done. This is the 7th one in a series that has come through my time here, and we'll have these available so you can click on them. I think we had 500 people click on the blood seminar we did last month, about 500 in the first few days on the one we did on infrared sauna the month before that. We have a couple of them on toxic accumulation and detoxification. So don't let your education stop here with these webinars. Click on them and take advantage of them. You can always go to brimhall.com. We have a list of all the seminars coming up and the speakers and profiles of the different seminars, including Homecoming as well, some of the specials that we have available too. And I think Mike told me we're going to be able to shoot out to everybody that's on tonight what the specials are in Biointerject and Zymogen products for tomorrow. So Dr. Burdette, without any further ado, let's turn the time to you and rock the world.
Thank you, Dr. Brimhall, for such a great introduction. And this is a topic that is near and dear to my heart, as it probably is to you guys out there. And the reason I say that is because, well, we all know how much of what we do centers around the gut. And it's really started to crystallize for me that the gut is if we stretch it out, the size of a tennis court. And so it's this huge window from which we can either become inflamed by the world or immune tolerant to the world. And it's really the switch that gets flipped in so many conditions. When you start to think about inflammation, now try to think of a condition that's not affected by inflammation, and you're hard-pressed to do so. So if any of you guys got to be at IFM this year, you know that a Dr. Fasano, formerly from Italy, he's now at Harvard, he received the Linus Pauling Award. And again, I appreciate his work so much. It centers around the gut, and it centers around some of these biomarkers that we're going to talk about tonight, in particular, something that he identified called Zonulin. And one of the reasons that I am so excited about what he's done, I tease and I call him my Brad Pitt of functional medicine, and you know, say I practically have the T-shirts and the posters to go along with it. But the reason I'm so effusive about his work is because his work demonstrates that we were right, we were right, we were right. What he identified was something that sounds sort of like Star Trek, this biomarker called Zonulin, and what Zonulin does, and we'll get more into detail with this, but essentially it binds to receptors on the gut mucosa and tells tight junctions to open up. It's the biomarker that mediates leaky gut. And when we drill down and see what he went on to figure out, what he figured out was that when zonulin goes up, i.e. this biomarker that mediates leaky gut, when it goes up 3 years before allergies, before autoimmune conditions, and before even certain cancers. And so again, it gets back to what we've been talking about for decades in functional medicine, which is if you change the diet, and if you change dysbiotic flora, and if you treat that organ, the gut, with the respect that it deserves, the switch between tolerance and inflammation, that we can make a huge difference, not only in the pathology once it occurs, but that we can also prevent these things from happening. And he goes on to say in some of his research that this subverts the current paradigm. It means that we can remove environmental triggers and we're not stuck in place waiting to get some condition. It's really as if he's been hanging out with Jeff Bland and other functional medicine docs for years. I think he must have been hanging out in the audience somewhere. So I thank him for validating this idea of leaky gut, because I remember sitting in naturopathic medical school, and I remember somebody stood up to give a lecture on autoimmune conditions, and she said, well, our approach is that we're going to treat the gut, and there's this thing called leaky gut. And I remember kind of halfway rolling my eyes, thinking, what is leaky gut? That sounds made up to me. When I go to PubMed, I don't find it there. However, you do now. And then I remember thinking, great, all these loans, and you're telling me that we're going to treat autoimmune conditions pretty much in a similar way by treating the gut. But that skepticism from that point of being naive has wholeheartedly shifted at this point. And so when you see person after person have miraculous change after miraculous change, it doesn't make the miracle any less important. It just makes the message stronger, which is that if we change what's going on in the body, if we change diet, if we change the gut, if we change this organ of inflammation, we can change outcomes across the board. And so when I started to kind of drill down in my head about what is the most perfect leaky gut strategy, what can we do as practitioners, what's going to hit the nail on the head, what's going to execute the strategy the most quickly, and we're going to win first, do no harm, all those pieces, I was thinking, okay, what's the most perfect leaky gut food? Does it come in a container? Does it come in a pouch? Is it square? Is it triangle? Is it, what is it? Is it something from New Zealand? Is it non-GMO? And as these ideas are whirling through my head, it finally occurred to me that really the most perfect leaky gut food is, the disclaimer, which is I'm on the board of advisors for Zymogen. I sit very proudly there, and that these are not intended to diagnose, treat, or cure. So there we go. And so as I began to think, really the perfect leaky gut food is what Mother Nature gives us, and that is breast milk. Baby comes on the planet with a leaky gut. That's why we don't introduce dairy, and if you do, that even blows out the pancreas and can cause a type 1 diabetes. And if we introduce these things too early, we can become atopic, allergies, eczema, asthma. And so really, as we enter onto planet Earth, we are here with a leaky gut. And so I think that I learned to think this way a bit from Dr. Evans, a PhD, who's also on the board of advisors of Zymogen. And one of the things that he says is, well, look to the research, see where the strength of the research is, see what pathways show up the most, and then figure out what we can borrow from that. How do we augment? How do we lift that? And so one of the things he talks about is exercise. Turns on a pathway, PGC1 alpha, which activates PPARs, et cetera, et cetera. And the point of that being, of course, we know exercise is good for us. And if this is the pathway that it turns on, anything we can do to amplify that it is very evidence-based, well-researched, well thought out. And so, for example, we can use something like a curcumins to also turn on PGC1 alpha to mimic that effect of exercise. Certainly not replace it, but maybe to supercharge what's going on there. The strength of the evidence exists. Turn to breast milk. Strength of the evidence exists. You're going to be hard-pressed to find too many studies that say it's worse to breastfeed than to not breastfeed. And so if that's the case, what can we borrow from what's happening in breast milk and then use that in our current patients, right? Because the idea of sending our 50-year-old male back to breastfeed doesn't make a whole bunch of sense. So but what can we borrow from what we know about Mother Nature and duplicate that? Well, it turns out that the enzyme that degrades histamine, DAO, diamine oxidase, is in breast milk. And the reason it is there is that the highest production of diamine oxidase that you are going to experience, well, half of us or some of us are going to experience, is in the placenta. Makes huge amounts of diamine oxidase. Why? Because placenta is one of the things that's put there almost exclusively by the male chromosome, and the placenta is there to protect progeny and to make sure that baby doesn't miscarry. And part of that is to break down inflammation, break down histamine, so miscarriage doesn't occur. In fact, low diamine oxidase is associated with higher rates of miscarriage, and so there is placenta producing all of this anti-inflammatory diamine oxidase. We birth baby, we birth placenta, but that diamine oxidase, because of those high levels, stays high as we are setting up Mother Nature's critical leaky gut formula, diamine oxidase. And so that was fascinating to me. We're going to continue to kind of see there's sort of a reproductive theme that goes along with diamine oxidase. And so we'll also talk more about immunoglobulins that are very high in breast milk, much like IgG 2000. So here what they saw was we see that there's diamine oxidase in breast milk, part of our key leaky gut formula. Thank you, Mother Nature. And then also flip-flop it. We can say that a different way. When you look at little colicky babies that are having GI distress, what they found was the ones that had more GI distress had less diamine oxidase, and those that were having less of the GI distress had higher levels of diamine oxidase. So what does that mean? It means that they're better able to degrade histamine. And so while we are familiar with things like red wine being high in histamine, and we know that we're more likely to get a headache or some people are more likely to get a headache from red wine, we're familiar with that. But it turns out all foods have some level of histamine. And as a food ripens or degrades, more histamine becomes present. So when I was giving this talk in Florida, a functional medicine practitioner had an aha moment. He came up to me afterward and said, you know, my wife always says I can eat a green banana, but ripe bananas make her arthritis flare. And he said, you know, I've always thought a banana is a banana is a banana. She's crazy. But he was like, I understand now that it might not be the banana, but it might be the histamine that's present in that food. And so like a good functional medicine practitioner, he'd done the things that we would all do. He'd removed inflammatory foods. He'd given fish oils. He'd given curcumins. He'd done kind of the gamut of what we would do in terms of treating the matrix, but still she was losing range of motion. When she introduced the Histio, a supplement form of diamine oxidase, that was the first time she began to see an improvement in the range of motion. So this is, as it was for him, it's been a real eye-opener for me. And again, I wouldn't say that as I'm here preaching to the choir, that you're learning anything new per se. It's just one more tool in a strategy that we're very poised to be the most effective with, treating leaky gut. So as we give Diyo, as we give diamine oxidase, we're able to degrade even minute amount of histamine in food to larger amount of histamine in food, and that creates a platform for a healthy gut. As we degrade more histamine, those microvilli where the diamine oxidase is typically made plump back up, and the body takes over and does the job on its own. And so that's another thing that really resonates with me about this topic, is that it's not about the pill, powder, or potion. It's about how do we use those things to launch people into wellness. And so we can even take a Diyo, we can degrade histamine and allow our body to plump up the microvilli, make more diamine oxidase on its own, and take over doing its work by itself. And maybe not entirely. We'll talk about how to dose this. To me, a higher dose is 1 with a small meal and 2 with a larger meal. I will sometimes go higher in those people that just can't accept planet Earth, but I don't tend to have to go too much higher than that. And then what I find is as we continue our leaky gut strategies, our good ProBioMax and our glutamine, and add in some OptiGHI, and we'll get to the IgG2000, as we're adding all these things in, what you'll pretty quickly see is that you're able to back that Diyo down and start doing maybe 1 with a medium meal, 1 with a large meal, and then eventually 1 with your largest meal, and then maybe carry a couple with you. So when you go out and you have an offending food and there's more histamine than your body's able to tolerate, take 2. I also use it acutely. If it's an environmental season, ramp it up during that period of time when there's more histamine exposure. But again, it tells our story, which is if we give the body the things it needs, the tissue will behave more normally, and it will begin to do that work on its own. And again, we're right. When you treat the gut, so many of these things, we're able to turn off that inflammatory switch and really bring that pathology back under control. So again, nothing new to learn. We know what histamine can cause. We know that if people, for example, eat foods that they're sensitive to, an IgG subtype 4 reaction or a C3G, a complement reaction, we'll talk more about that. If they eat those foods they're sensitive to, or if there's more histamine, we would expect GI issues, stomach ache, colic, diarrhea, headaches, even Crohn's, ulcerative colitis. So we already knew that all of these things are driven by histamine, but again, it might not be the amount of histamine that you create that is relative to your body's ability to degrade it, diamine oxidase. I liken this to, for example, the autistic kid who's exposed to lead or mercury will probably have more issue with that than I will have. Same amount of lead or mercury, but I'm better at detoxifying it. Same type of idea here. One person's histamine, they might have a better ability to deal with that than somebody who does not have the same level of diamine oxidase, that individualization. When we've seen it clinically, right, that somebody can maybe have a series of +1s on a food sensitivity test, and man, if they just come across a little bit of that, they are so reactive. And yet somebody else just says, oh, I eat those all the time and don't have any problem with them. Well, now, again, inflammation can be silent, so it results in a pathology, right, like a C-reactive protein. So there's something to still be said to that person, but my point being, some of us are better at degrading the histamine than others. So I love this slide, and it's hard to get through one of these presentations without a slide like this that says, oh, what I'm talking about affects everything. However, I would say that you could take histamine there in the middle and put inflammation in the middle where it's at, and the same argument would be made because it creates inflammation. More specific than that is certain tissue has histamine receptors, the brain. The skin, we figured that out. We knew rashes and histamine. Respiratory tract, we got that too. Histamine, allergies, asthma, we got that. Cardiovascular system. Okay, I think that I had recognized that if I got rid of foods people were sensitive to, that they were likely to have potentially less tachycardia, maybe less palpitations. But I don't think I got it to this drill down kind of level until, again, gave this talk in a practitioner, high functional medicine practitioner in San Diego, very busy practice, very good practitioner, heard this talk, has had arrhythmia her whole life. And this part of the slide over to the left caught her eye. She said, I'll measure my diamine oxidase. She did a serum level. It was quite low. She was a little surprised because she's a functional medicine practitioner and has been eating very clean and doing a lot of gut work for a long time. But she also knew she was more sensitive. When she went out to eat, she would have problems despite her clean diet. So keep that in your head. These people that struggle despite all of our changes, again, it might be that they can't degrade histamine as well. So her level was low. She took the Diyo for the first time ever after, she'd done the fish oils, done the magnesium, done the copper, done the food removal, et cetera, still having arrhythmia, took the Diyo, first time ever not having arrhythmia. Because there is a subset of arrhythmia, and these people will have more mast cells in the heart than normal controls. Very interesting. So back to that idea of when our patients come in and say, can I eat my +1s? Well, it's not only about the food and how much histamine, but the end target, how much mast cells, how much histamine is going to be released from that. If you eat foods and it affects you cardiovascularly, you might have more mast cells in your heart than I do. That's why those foods affect you more. Same is true in the central nervous system. Did you know that MS patients have more mast cells in their brain than normal controls? So again, it becomes this idea of the more severe the condition, the more strict we need to be with these interventions, because your end target, your mast cells, might be different than mine, right down to number, not just how they degranulate. So very fascinating. And this is a part that again, is that reproductive tie-in that I was mentioning before. And so, okay, I think that I got that, for example, if someone was eating a more inflammatory diet, they were probably going to have more cramping with their period. Or if they're postmenopausal, they might be having more hot flashes, and you clean up the diet and you see a difference in that. But I don't think I got it right down to this level, that more histamine drives estrogen dominance and can create some of this dysmenorrhea. So for example, as practitioners, we can get caught up in the therapies that we know, and sometimes they can, especially when you've had a lot of success with them, then that can be kind of the end-all and the be-all for what works for that. So for me, headaches before a period, that's progesterone's dropping off. That's your estrogen dominant. I'm going to do things to help increase progesterone. It might be the Progensa 20. I might use some vitamin A. I might use the Corticare for the B5 that also increases progesterone. But we're going to increase your progesterone. We're going to decrease estrogen metabolites, and you're not going to have headaches anymore. Well, lo and behold, not every patient always responds the same. And so this was very interesting to me to figure out that not only does progesterone drop the week before your period, but diamine oxidase drops the week before your period as well. So now, different practitioner in Texas giving this discussion, migraines the week before her period, same story, functional medicine practitioner. She's done the bioidentical progesterone, she's done the fish oil, she's done the magnesium, she's done the Pedidolex, and she's not, et cetera, and she's not getting to a place of no migraine. Here's the talk. She doesn't measure her levels. There's a bottle in her office, takes it home, and in this case, I tend to dose it 1 a day the week before the period. That's what she did, no migraines. So as you guys know as practitioners, who calls you? Who picks up the phone to tell you things? Well, often it's that squeaky wheel. Maybe the patient is not the most happy about something. That tends to be who's going to call you. Not that I would know about people being unhappy at Dunwoody Labs, which I'm the owner of, but so this is one of those cases where people are making time out of their day to call me up and tell me, oh my gosh, I've had an amazing amount of success with this. And again, I don't think that it's something different that we're doing. It's just one more tool in that very effective strategy of treat the gut, treat the leaky gut, and we can turn off the inflammation. So here is what I was talking about earlier, that when there's low diamine oxidase, that can be indicative of a high-risk pregnancy because you're not breaking down the inflammation that causes that rejection. And here's what I just mentioned, that diamine oxidase falls off the week before the period, so it gives us another way of using it, not just to reduce histamine per se, but to reduce the excessive histamine that we can experience when this occurs. So, again, we knew headaches were associated with histamine. It's just one more way we can apply this tool. So when there is more damage to the mucosa, you see the mucosa start to erode. And so levels of enzymes will fall off, but also diamine oxidase falls off. So I put together a profile that has diamine oxidase on it, and then it occurred to me, I should put zonulin on that same profile. These are both markers of gut integrity, one because of its microvilli are atrophied, zonulin because of opening up of tight junctions. And so put these together with some histamine and then a diamine-histamine ratio so that we can really help to track efficacy of therapy. And as you all know, really to motivate patients, we can take a history and we can figure out a lot in terms of leaky gut. But when those things start to jump off the page to patients, that's when they can really kind of see, oh, wow, this is going on in my body. And for me, I really think it builds the motivation for therapy. So we can use it. We can track how healthy our gut is by measuring levels of diamine oxidase. And again, there are different reasons that we can have more histamine excess, like allergies, even overconsumption of alcohol, which not only can have histamine, i.e. red wines, but also inhibits diamine oxidase. And so again, that can be part of the hangover people get from overconsumption. The nausea and the headaches is the inability to degrade the histamine that comes with it. Poor red wine. And then here are the sites that we would most associate with a histamine effect, right? And we got that already. We knew gut, we knew lung, we knew skin, but don't forget cardiovascular system and brain. Those were very interesting to me. And so we produce it normally in the small intestine when our gut is working well, a little bit in the colon, lots in the placenta, and small, minute amounts from the kidney. In fact, the His block is sourced from a porcine source. So again, we knew that histamine had many effects in the body, arrhythmia, day-night rhythm. That's why when you take Benadryl, it makes you sleepy because it's decreasing that neuroexcitatory effect of histamine. But I was not as well aware of this. I suppose that I had in my head MSM for allergies, so maybe something methionine containing, but I don't think I got it quite to this level. So over to the left, you see histamine being degraded by diamine oxidase. But another person who's going to have histamine excess is your poor methylator. And one way we start to think poor methylation can cause about anything, and I think there's some reality to that. That might be why testing from different levels helps to direct us. But don't forget about it in terms of your leaky gut strategies, in terms of your histaminergic type conditions. Over to the right, N-methyltransferase is driven by S-adenylmethionine, one of our go-to methylators. And so the more we can use a SAMe, the more we can help to methylate intercellular histamine and degrade that, break it down into N-methylhistamine, which does not have that pro-inflammatory effect on the body. And this one's a little small to test your seeing, I suppose. Let's do it this way. And don't forget that I describe it to patients like wheels in a watch, one turning the other, everything making the other go. This is why you'll see things about people with methyl tetrahydrofolate defects, SNPs, having more of an issue with leaky gut, more of an issue with histamine, because that methylation step is critical in terms of breaking down histamine. And so we can use our SAMe, we can use our 5-methyl tetrahydrofolate, and we can start to fold those into our leaky gut strategies as well to be one more way we can begin to degrade histamine. I was just reading more on this today, some very eloquent studies that were done looking at histamine there in the brush border, and what they found was when they gave S-adenylmethionine, less histamine, better gut integrity. One more application for something that has so many uses, improving mood, the SAMe, helping liver function, and now part of our leaky gut strategy. So foods that contain histamine. Tuna, that's supposed to be anti-inflammatory. So that's a good clinical clue. If you take a history and they're reactive to some of these things with omega-3s, I suppose it's the wisdom of, again, Mother Nature. If you're going to have more histamine, put some omega-3 in there as well. So if they react to something like tuna, you might begin to think, aha, low levels of diamine oxidase, more reactive. And so the older foods, like our aged cheeses, anything older, even things fermented. So it's important about what strains get used to ferment, sauerkraut, etc. And check out champagne there on the bottom. It's no wonder that New Year's results in headaches for everybody. It's not necessarily the champagne, but the histamine that's in the champagne. And so when they biopsied the gut of people with Crohn's, what they found was lower levels of diamine oxidase. Aha! Again, Crohn's, colitis, leaky gut. I mean, ulcerative colitis, you can't quite be more leaky than an ulcer. We can use the HistDAO as one more arrow in our quiver to help here. Now here is the, back to what Dr. Brimhall opened with, that hopefully will reach an age and a time where natural therapies are the first line, least invasive, first do no harm, and then if we had to, moving up the ladder of invasiveness. These are medications that inhibit diamine oxidase. Unfortunate, because drop down to the bottom, third from the bottom, cimetidine, Tagamet. Now, let's think back to those first couple of slides. Who comes onto this planet with leaky gut? Babies. And the colicky babies have less diamine oxidase. So what's the therapy they're usually given? Tagamet to block HCl. And then what happens from there? The Tagamet blocks diamine oxidase as well. They can't degrade histamine. That breaks up the gut. Leaky gut gets set in place. Now potentially more food sensitivities. I think it was Bettina who first shared with me a piece of research that we all probably knew to be true, but it was nice to see documented, that when people are on H2 blockers, that this can increase IgG food sensitivities. So they start off already having gut problems. We give the H2 blockers, inhibits diamine oxidase, less breakdown of histamine, more inflammation. We're off to the inflammatory races. What happens from there? Probably they become, for example, sensitive to dairy, more earaches. Check it out. Here are the antibiotics that will probably be given for the earaches. They also inhibit diamine oxidase and kill off our good flora. One foot further forward into a gut of leaky, or a life of leaky gut, unless they get to talk to somebody in the functional medicine community. And then I'll stop there because, I know I'm sort of on, the soapbox. We kind of get it that medications have side effects that we need to think about. But, well, antiarrhythmics, we talk about mast cells in the heart and arrhythmia. And then the bottom one, antidepressants. And amitriptyline is listed there, but SSRIs also inhibit diamine oxidase. So we, as a community, recognize that depression has an inflammatory component, whether or not that is an excessive intake of gluten. That is, I actually read this interesting piece of research about how when you take tryptophan with gluten, it decreases blood levels versus lactobacillus with the tryptophan. And when they compare just starch to the gluten, not that same effect. So again, whether or not it's a gluten issue or inflammation in the gut that increases interleukin systemically, that damages lipids, and the brain is 85% fat, or inflammation, decreasing glutathione, hundreds of studies about glutathione causing depression. My point being, the antidepressant decreases the activity of diamine oxidase. We don't break down histamine as well, more inflammation, and we well recognize that there was an inflammatory component to that depression to begin with. So the cycle of never getting off the medication begins unless we can intervene. So think about HistDAO. It's also an adjunct therapy as you're trying to wean people off medications, or if it's not a time or place for the medication to be eliminated, then using it so we don't create another problem alongside that. And, you know, I didn't even get on the soapbox about the antidepressants damaging the mitochondria. Mike Muscle, you're the one that shared that research with me. And then also antidepressants decreasing bone density. So all of these are opportunities for at least adjunct therapy to make sure that we protect a person and we first do no harm. So when the gut's ischemic, lower levels of diamine oxidase. Another time that you see ischemia into the gut besides this injury, like in this piece of research, is our athletes. And so I used to commonly note more leaky gut in people that were overtraining, maybe hitting a plateau, having some issues there. And I used to just think, oh, well, that means they're just using so much glutamine, and glutamine is going to the muscle mass as well, and it's getting robbed from the gut. And that's why I'm seeing this leaky gut in athletes. Well, it turns out that that's not the entire picture, that the leaky gut that you can often see in athletes with overtraining is as simple as more time in fight or flight, less time in rest and digest. And so ischemia to the gut, essentially. And so what you saw with that was zonulin went up, but this is nice, it's not just academic. Then when they gave probiotics, particularly the HN109 strain, you saw zonulin come down, and you saw markers of inflammation associated with overtraining, like TNF-alpha, also come down. Again, we were right, we were right, we were right. If you treat the gut, less inflammation, and a new way to intervene with pathology. So, again, we not only can we be atopic because of too much histamine, but also an inability to degrade it. And there can be SNPs. So I was talking about how most people will be able to back down a HISTAO, and their body will take over, but there can be the population with the polymorphism that might need this therapy more ongoing. My guess is that we might see something like this in our autistic kiddos, and I'm working with an autistic clinic right now to gather some of this data and see if diamine oxidase might be another part of their leaky gut strategy. So we're familiar with this. Foods leak through the gut, triggers the mast cell to degranulate, and if we use something like a HISTAO, we can block that from happening. And we can use it not only for the gut, but systemically as well. It is taken up by lymphatics and moved systemically into circulation. And I can tell you this because when you take it, you see it go up from serum levels. That means it's not staying there in the gut. So again, that's another, here's my point again, nothing new to learn. You are already going to use a pure omega, a nice omega-3 to stop inflammation associated with histamine. We knew that already. It stops degranulation of mast cells, but at the same time you're doing that, you're increasing the microvilli, plumping them up to produce more of their own diamine oxidase. It's that wisdom of natural therapies, their epigenetic type of effect, the reason that we can use something like a fish oil and change diet and get better results in some cases than even a prednisone with way less side effects. Again, our good probiotics, Saccharomyces, forms this shield over the microvilli that help them to produce more of this diamine oxidase. And so, again, nothing new to learn. We were going to treat the adrenals when we knew somebody had a histamine excess. We wanted to get cortisol up to compete with the inflammation of histamine. And now, when we include our B5 and our B6 and our vitamin C, we've got our B6 here and our vitamin C, which are also cofactors for diamine oxidase. The wisdom, that epigenetic effect. This is a great one to me. Nausea with chemo. When people have lower levels of diamine oxidase, more nausea. So we can use HISTAO to help with the nausea of chemo. And if all we did was help somebody to eat, then I think that that is one of the major things that we'll be able to do to help them to maintain therapy. And if you've ever seen those curves of chemotherapy, the worst case scenario is to do some of the regimen, get halfway through, 60% through, and have to drop out. Why do I say that? Because chemo does not work in terms of a little bit, a little effect, a little more effect. It's when you get to about 80, 90% of that regimen that you see that's when you start getting efficacy. So if you have to drop out halfway through because you're cachexic and you're going downhill, then what that means is you're getting the toxicity of that without the efficacy of it. So if we can give something like a HISTAO that's not going to have an interaction, then to me that is a profound adjunct therapy. I'll give a shout out to IgG 2000 as well, a nice write-up of a woman who was losing weight, adenocarcinoma, about to be forced to drop out of therapy. The only therapy she began were the immunoglobulins, like breast milk, IgG 2000, and began to gain weight while still on the chemo, and was able to get to the end of the regimen. Again, kind of our leaky gut idea there. So if it's low, we can have more headaches. We can take Diyo to deal with that. And so here's a patient that presented with chronic hives and gut issues and only maintained on prednisone. And so look at her level of diamine oxidase in the tank, high level of histamine, neuroexcitatory, anxious, not feeling good, and her ratios bottomed out. Now again, I now have Zonulin on this profile. At the time I did not, but I kind of liken myself on a lab front to Zymogen in that when research comes out, my markers change. You're not going to be looking at the same profiles 5, 7, 10 years down the road, just like when you pick up that bottle of functional food from Zymogen, you're now seeing all activated B vitamins instead of folic acid. Why? Because every year, twice a year, the board meets, docs like Dr. Brimhall, myself, Bettina, Mike Muscle, and then MDs, chiropractors, naturopaths, dietitians, nurse practitioners, pharmacists, PhDs, acupuncturists. Have I left anybody out? Anyway, my point being an integrated mix. We come together, we share research, we say this is dated, this should change, and the shift happens. So again, my point being that Zonulin is on here now, another marker of gut integrity. So here's pre, here's post. Maybe it's easier to see like this. 2 weeks later, on the Diyo, 2 twice a day, which again was my higher dose, but her hives are so bad, she's scratching through her skin, bleeding. So yeah, and only maintained on prednisone. So yeah, this fits more extreme, higher dose. Look how it shoots up tremendously, and the ratio shifts, and the patient feels better. But look how the level of histamine has not changed overall. So what that says to me is I need to continue to do the functional work, figure out where the histamine is coming from. Is it a food? Is it a bug? And then I need to continue to work on that. But in the meantime, she's able to back down her prednisone, and she successfully gets off the prednisone. She feels better. Her energy is better. And it's the first time she feels better, not worse, and she has hope. And this is what I mean about it's not about the pill, powder, or potion. It's about launching people to wellness. Because when this happens, when it's the first time she has hope, now she's going to come back and say, what else should I do? And the things that we're going to talk to her about doing are going to be the same things that we would all talk about. More exercise, better diet, and once the crazy voodoo works, they're willing to do whatever crazy voodoo it is that we have. And in general, the biggest part of our crazy voodoo is change the diet, increase exercise, change the lifestyle, turn off the inflammatory switch. So the whole idea of kind of breast milk and leaky gut and what's going on there swimming in my head. And so one of the tests that I have through Dunwoody Labs is a food sensitivity test. And I am well aware that I probably haven't had too many original thoughts, but I know a good idea when I hear one, and I am not afraid to borrow it. And so, and that's one of the nice things about being able to go around and speak to our community is there are a lot of you out there that have really brilliant thoughts and have had really amazing patient outcomes, and I get to share, maybe borrow, maybe steal, but reflect back these ideas and these things and say them again out loud to our community and really affirm what we do. So here, again, I'm not telling you anything you don't know. We know about food sensitivity. This test looks at all 4 subtypes of IgG and also looks at C3d, complement antigen. Why is that important? Well, again, not my idea. The person that designed this test, MIT grad, Harvard postdoc, polio vaccine, worked on the polio vaccine, and then this test was launched in Europe and is a decade strong there. It just wasn't being run here. Well, what he figured out was that complement really triggers that IgG, and that's when you get your most inflammatory reaction. So if this is the most inflammatory reaction, if there's a successful treatment for it, then it means we have a treatment for what is most inflammatory. And so what I did is I pulled 300 pre and post food sensitivities, and I looked at who got better on paper and then who got better clinically. And those two things matched. That's good. That means the test is valid. When there are less food sensitivities, people felt better. Great. And this is unpublished right now, but I've hired a doc. He's currently working on publishing this for me because that's what we need. We need to have more in the literature, demonstrates medical necessity, keeps insurance alive, and demonstrates, more importantly, the clinical utility, so we can stop treating conditions with prednisone and start treating them with lifestyle intervention. So, very inflammatory. We don't want inflammation all over something the size of a tennis court in our body. Here's kind of how C3b, IgG interact. And there are other ways of testing out things, are valid. So IgG and immediate food sensitivity, we need to know that. If we're going to drop dead from eating a peanut, that's a valid test. It's just that by the time people come to us, they've figured out if they eat the strawberry, their lips immediately swell. And so what they're now looking for are more of those chronic, insidious reasons for inflammation, chronic fatigue, joint pain, etc. IgG4, another test that exists. Good. IgG4 will also pick up sensitivities, but you'll miss IgG 1, 2, and 3 as well as that complement that's food specific. Live cell analysis, also good, but there are reasons that white blood cells swell besides food sensitivities. Mike Munsell, you're the first one that made me think about it this way, and then I tested your theory out by asking immunologists out there in the world if they agreed with you, and yes, they do. And so there are positive reasons white blood cells can swell as well. In fact, NRF2 activation. And so with a live cell analysis, you risk getting a false positive to things like turmeric or grapes because they have resveratrol, or green tea. And I would argue those might be some of the very foods that we don't want to get false positives to. Now, not to say you can't capture some data, but it's not. Food sensitivity is not the only reason that white blood cells swell. IgA, local in the gut until the gut becomes permeable, and then you'll get systemic symptoms from that as well. So, again, IgG can be related to those same three things that Fasano noted: autoimmune disease, allergies, and cancer, all increasing zonulin to increase permeability of the gut, all jumping down to the same conclusion. And we can see it higher in different pathologies. And I don't have too much time to talk about the metaorganism, but it's such a fascinating, it is so fascinating. And that's why I feel, that's why I see such faster shift when we work with strains that are meaningful. So this HN109 that's in the ProBiomax, I choose that for the same reason that you guys would choose anything. It has the most research. Go to PubMed, type in HN109. You'll find a couple hundred of studies about that with an N of 600, seeing 80% resolution in IBS with just that probiotic, an N of 200, safety in children. And this was such cool research to me. So they took people from different countries, Spain, France, England, Ireland, and they said, where you live should determine your flora. Soil, terrain, gut flora. That's where it comes from. So if you live in a similar area, you should have similar flora to people around you. They did not find that at all. What they found was the older you were, the worse your flora, and the specific one that we think about in kids, HN109, Bifidobacter. So it's low when we come onto this planet with leaky gut. It can become low as we go off this planet with leaky gut. But this is more important to us. It wasn't just about age. The thing that correlated the tightest was how frail you were. And the more frail, the less Bifidobacter. And so what they said was, how helpful is this? Because it's much easier to give probiotics than it is to change aging of a cell. And so that's what they did. They gave probiotics, Bifidobacter, and what they saw was less inflammaging is the term that's used in the research for this. So that good probiotic puts that shield in place over your microvilli. Yes, you produce more diamine oxidase, but you push back at the inflammatory world and you become more tolerant. And so when they gave those probiotics, what they saw clinically was less trips to the hospital. if you went to the hospital, less deaths in the hospital, less colds or flus to get you to the hospital in the first place, and then something they didn't expect to see, less conditions of aging, less inflammatory changes, less degenerative changes, because that gut is our wall between inflammation and immune tolerance. So that's the probiotic meta-organism in a nutshell, very nutshell. I didn't even talk about inflammasomes yet. And so, let's see. Let me get to that unpublished data. I'll just do it this way. And so then I have been sharing this lecture, and we're going to get to this case study. And what we're going to see is that she does the I5, the immunoglobulins. I'm going to get to those. She does the Probiome Max, not the DF in this case. I know that's what the slide is showing. And then she did more IgG 2000. And so after giving this lecture at a Zymogen Experience, I was talking out in Colorado, and a practitioner that specializes, he's an MD, he specializes in just IBS, and he stood up and said, I'm here because I've used your protocol in the last 200 patients that I've seen with IBS. And first, some little part of me kind of cringed on the inside, because I like to think, oh, I don't have protocols, and I individualize to everybody. But, you know, we have our go-tos. And so, but then I was, I cringed less when he said, and that's the most success I've seen with 200 IBS patients in my career. So again, I would never go as far to say that it's my protocol. I would say it's our protocol. As functional medicine practitioners, we've been giving probiotics, and we've been doing things to treat the gut. But when we have tools that are more powerful, we get more profound outcomes. And this probiotic is one of those to me. So post-op recovery, if we treat the gut, we can have favorable outcomes. We can use Saccharomyces to compete with dysbiotic flora, even other yeasts like Candida. And this one, while maybe does not visually catch your eye so much, was an important slide to me. 42 to 69% of the population is going to have some gut disorder, and 75% of them are not going to seek medical care. Well, if the gut is the inflammatory switch to conditions of aging in general, and 75 of the half of the population that has that is not going to seek care, no wonder we're in the healthcare crisis state that we're in. But I get it. I wouldn't go in for that either. I don't want an H2 blocker, and that's going to be what's going to be the major solution out there. But if someone told me that I was going to take Probiome Max, and that I was going to take that, that's a nice, strong, high dose when I'm talking about the 100 billion CFUs, but with the most adherence of any of the ones out there, so more is not always better. What you want is the stickiest one, the one that's going to set up shop and start dividing on its own. That's what's going to give you the lasting effects, the less pills, powders, and potions, the most health and wellness. So if I knew that I was going to go in and get a probiotic, and I was going to take Probiome Max one a day for a period of time, maybe 1 to 3 months, and then after that I was going to do 1 3 times a week until inflammation had calmed down in my system, and then I might even be able to come off of it, assuming that I'm eating a good, clean, non-inflammatory diet. That's a therapy that I'm willing to seek. And now on top of that, you tell me that it's going to reduce conditions of aging, possibly right down to my rate of wrinkling. I'm in. And I think that's how we solve the healthcare crisis, is with meaningful therapies. So we can have all this inflammation mucosally, and it will cause more systemic impact, like TNF-alpha. Even in a healthy gut, some proteins leak through intact. And so we've covered this a bit. If we change the milieu, we can change that. Let me get here. Okay. So here's that patient that I was speaking of, the one where my protocol came from. And she's our typical kind of patient, right? She's gaining weight, her blood pressure is up, and she's got no energy, but everybody says there's nothing wrong with her. Sigh. And so here's her food sensitivity test, measuring all 4 subtypes of IgG as well as C3d, possibly the most inflammatory mediator in terms of food sensitivities. So if you're not measuring it, you could miss things. And most of them don't come back looking like this, usually 5 or 10 things, which makes it easy for compliance. I picked this one because it's easy to visualize. She lights up like a Christmas tree. Yikes. And so here's what we did. we did the I-5 with the immunoglobulins in there. Now, in my clinic, I call IgG 2000, or these immunoglobulins that are in the I-5, I call it gut immune max. So I must have got some way, because I pick out the private label names, as creative as that one is. So I must have got on some face that it does something for the gut. But I don't think I got it to this degree. So there she is. We get her started on the I-5, nice sulforaphane, so good glutathione production, reducing inflammation in the gut, arabinogalactans, increasing secretory IgA, continued her with just the IgG 2000 and the ProBiomax Plus. This was the protocol that the IBS doc spoke about being effective. And so here are those 300 charts. And then here's kind of was the aha moment for me. Poor little gluten head baby. And this was New York Times from last February, and they quote my boy in there. They talk about Fasano. So you know I'm all eyes and ears because I'm all, you know, Brad Pitt over him. So what he was talking about in here was the fact that there was this area in, I believe, Sweden that went from all breastfeeding to no breastfeeding. And what do you think happened? Food allergies skyrocketed, celiac skyrocketed, and he goes on to talk about zonulin. So zonulin, this great marker, validates what we do. It tells tight junctions to open. It is the biomarker of leaky gut. And so great, we can track leaky gut. We can measure it. Is it coming down? Are our protocols effective? Hey, guess what? It goes up in patients. He talks about it going up before they're even full-blown celiac. So we can catch somebody before they're in this state that's harder to move them out of. So preventative kind of measure for it as well. Remember, it goes up 3 years before autoimmune conditions and allergies. So again, we can prevent conditions from occurring by turning off inflammation. And so since I'm all gaga, I'm looking at all his research. And so Fasano's doing what any researcher would try to do, which is make money. As we know, budget sequester, NIH grants are only the top 7% of grants are being funded anymore, whereas 10 years ago, more like 20 to 30% of grants were funded. So not a lot of money in science. Got to find it elsewhere. That's drug discovery. So Fasano's doing what any good researcher would do: try to find a drug that blocks the biomarker, right? I mean, that is like a statin and cholesterol. That's a home run moneymaker. So his idea is find a drug that blocks zonulin. Now tight junctions won't open up, and now everyone can eat junk. We're home free. Tease, haha. So in these studies, what I'm looking, and what he's using as a control in these studies to determine how effective his drug is are immunoglobulins, just like IgG 2000. And at first I'm like, whoa, that's the wrong direction. Wait, I'm confused about that. But as I read more, these immunoglobulins have a very similar structure to zonulin. And because of this similar structure, they can block zonulin from binding. And so you get this like hitting the garage door button, but hitting it closed, an immediate closing of tight junctions. I remember at this year's experience, as I'm an experience, standing around with practitioners, and we were saying to each other, do you think it's gotten easier? And you all know how hard leaky gut is and how hard the gut patients are. They're sensitive. They don't have diamine oxidase, so they react to everything. They even react to our therapies. It's hard to get a foothold with them. And so we're all standing around saying, yeah, I think it's easier. And I think one of the reasons it's easier are tools like the I-5. And so and I'm sort of attributed to, okay, I-5, sulforaphane, upregulates phase 2, so my sensitive detoxifiers, my pathologic detoxifiers, they don't have as much sensitivity because we're just moving the junk out. We're not upregulating phase 1. And so I was like, okay, that's why this makes sense. I don't get as many of those phone calls of I feel worse before I feel better. But the second part of that is these immunoglobulins. They block the zonulin, close down the gap junctions, put the barrier back in place, a more immediate effect. It doesn't mean you don't do your functional work. We still look for the foods. We still look for the bugs. We still spackle with the glutamines and the probiotics, but we can immediately shut off some of that inflammation. People feel better, not worse. They come back. They buy into the crazy voodoo, which is eat more vegetables, and exercise more. I have really seen the effective products be a launching pad for health and wellness overall. So that, and back to my original starting point, what is the most logical, what's the most natural leaky gut protocol out there? It's breast milk. What's in breast milk? Not Diyo, but Diamine oxidase, not IgG2000, but immunoglobulins. And when you put these things together, we can really mimic what's happening in that most natural leaky gut formula and have those same outcomes that you see in the strength of the research of babies who breastfeed for, at least 12 months, etc., much less allergies, much less inflammatory conditions. So again, we already knew that the gut housed 85% of the immune system. We knew that that's where we made 95% of our serotonin and 400 times the melatonin that we make in the pineal gland. We knew that the gut is where that switch is flipped. Are we inflamed? Are we tolerant? And so I think that we can use, yes, some of these biomarkers to direct therapy. In my opinion, something like the IgG2000 is a specific therapy for zonulin. Something like a Diyo, clearly a specific therapy for low diamine oxidase. And when we start to layer these things in to the therapies that we're already doing, we can really augment those outcomes, turn off inflammation, turn off conditions of aging. And I wonder if I can quickly enough get to Fasano's language. He's so smart here. Living life on the edge of the wall. I love the way he talks. So here's the schematic, IgG2000, and binding to these receptors on the gut mucosa. So there's gluten, comes down, triggers the release of zonulin, pops up, tells tight junctions to open up, everything leaks through it's intact, and we're off to the inflammatory races. But if we can layer in these therapies, if we can use our immunoglobulins and use our diamine oxidase, and I'll finish on this slide, we can, well, I'll use his words because they're better than mine. This new paradigm subverts traditional theories underlying the development of these diseases and suggests that these processes can be arrested if the interplay between genes and environmental triggers is prevented by reestablishing the zonulin-dependent intestinal barrier function. We were right, we were right, we were right. If you treat the gut, you turn off inflammation, and you change outcomes in a meaningful way. Are we there?
All right, fantastic.
All right.
Dr. John, are you there?
Yeah, we are here. That's awesome.
Great. Great job.
We want to highlight, too, that we're going to be covering this at Homecoming from many different directions. There we put the preventive medicine and holistic medicine, laser, craniosacral, visceral manipulation all together. A lot of the bioenergetics nutritionals are synergistic blends, and we have one called Max GI. It's designed to allow the whole gastrointestinal tract to heal. We have an incredible adrenal product called Max Adrenal, believe it or not, and it helps to balance out the cortisol to DHA ratios and helps the body heal from the inside out. We'll be talking about Max Mito, which is a mitochondrial resuscitation nutrition that I have used now almost for 20 years with improving it through the Zymogen ability to produce the best products in the world. It's very exciting to have Dr. Cheryl with us, very excited to have Mike helping us out here, and we look forward to seeing you. We're probably going to have our webinar 1 month from today again, because the third Thursday I'm actually going to be in Alaska lecturing. So Mike, if you can put that down on your schedule. We are going to post this webinar along with some of the nutritionals that are available through here. And I don't know if you want to make any comments on what we have here before we sign off, but I appreciate the opportunity and look forward to have Cheryl with us in January in Arizona. It'll be nice and warm.
I can't wait to be there, and I look forward to more partnering with you, Dr. Brimhall. I can't wait to take some of those products that you just mentioned and get more data, look at the zonulin, look at the diamine oxidase again, so we can keep doing what we do so well.
Yes, ma'am. It's a joy to work together. Like I say, being on the board is just an amazing situation where you have all these different professions and professionals working together for a common goal to help the universe to be a healthier place to live naturally.
Yay.
Fantastic, guys. Before we depart here, there was just one quick question, Cheryl, on the testing. Some folks are asking on the message board here, what's the best way to test for Diyo? Where can we learn more about that? Can you expand on that a little bit?
Yeah, you know what? I think I'm the only lab that does that right now. So Dunwoody Labs, at least in this country. In Europe, they recognize it as a full-fledged diagnosis. They've figured it out, histaminosis. You measure diamine oxidase, and you treat accordingly. Here, we're just behind. Serum blood draw and send it over, and then on that profile, you can look at diamine oxidase and zonulin together. However, as a clinician, we know that sometimes, well, all the time, we want our patients to have more room for therapy in their budget than just testing. So you can always order single analytes as well, and that's real helpful for follow-up testing, that you never have, you can just repeat what was out of range. And of course, that comes with a decreased cost. And then one thing that I am doing is I have priced what I call my gut triad very competitively, right around $695, $750, somewhere right in there. And what that gut triad includes is 132 food sensitivities, and in my opinion, the most sensitive way to look at foods, all 4 subtypes of IgG plus complement. That's what the immunologists, they really activate that inflammatory reaction. I'm the only one that does complement right now. We have a patent on that. But the gut triad includes that, stool culture, and then also the Zonulin DAO profile. And so that's a really very competitive price. And the reason I put those together is because where's the histamine coming from? Is it a food? Is it a bug? And how able are we able to degrade it? And what health is the gut in, the DAO and zonulin? So I thought that gave us a really complete picture to this leaky gut that affects so many people.
Yeah. Fantastic. So dunwoodylabs.com, that'd be the best way to kind of get more information on the testing?
Absolutely, yep.
Good.
And excitingly, she's going to have the lab people there represent the whole weekend at homecoming, so they'll be there to answer questions, and that should be really exciting, too, to get to see it firsthand.
Absolutely. Yeah, maybe we'll bring out some salivary specimens for people to see, at least a secretory IgA or anti-gliadin antibody.
Mm-hmm. Fantastic. All right, everyone. Well, thanks so much for joining us. You'll get the archive recording tomorrow along with the special. And I hope you all have a great afternoon and evening.
Thanks, everybody.
Thanks, guys.